You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. More and more people are getting sedated when they go to the dentist. Today's topic, sedation dentistry. If you are afraid of the dentist, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. With us today, we have Dr. Roger Briggs and Dr. Brad Briggs, the father and son team of dentists who are helping people that are afraid by offering sedation. They are the founders of Briggs Family and Cosmetic Dentistry. Dr. Brad, Dr. Roger, welcome to the program.
Thank you, Randy.
Now, before we move into today's topic, sedation dentistry, and what people need to know, tell us about Briggs Family Dentistry.
I started Briggs Family Dentistry in 1973. So when I finished my dental school, I went to Scottsdale, started the practice, and I was lucky enough to have my children get involved in the practice. My daughter's a hygienist in the practice, and Dr. Brad has been with me now for 4 years. And so
did you want him to be a dentist?
After he told me he wanted to do it, quite frankly, and he really got into it, I told him, listen, if you don't do this, I'm going to have to take you out and start another one because I like it.
Is that right?
Yeah.
Now, he doesn't look like a dentist. I think you look a little bit like a dentist. But when did you know I want to be a dentist?
Well, I started school out as an art major, and after a couple of years of taking art classes, I figured that dentistry is basically doing art, and I always wanted to do something to help people. So it filled both of those needs. It's my art form,
okay,
and I'm helping people.
Okay, sedation dentistry is today's topic. You know, we were talking off camera. It's hard to believe, and I haven't had a whole lot of dental experience where I go in. I mean, nobody likes going to the dentist for the most part.
That's normal, Randy.
But you say there's phobia. I mean, there's some serious
There's
people
all
that are
different levels of phobia with the dentist. There's everything from people who just don't like the smells and the sounds of the dental office to people who can't even pick up a phone and call, and they have to go to extreme, be in pain before they can even
Is that right?
Yeah,
call.
well, Stacy at our front desk, she is the sweetest, happiest person you can imagine. And every once in a while, she'll come back and say, you know, someone with a great deal of fear called and broke down and said, I'll have to call you back.
Okay.
They couldn't even finish the conversation.
So we've been on the show before, and we didn't actually get to talk about sedation. We didn't.
Yeah, you called me. You said, I want to cover this in a more detailed way.
It's a big part of dentistry is dealing with fear, so we thought we wanted
Do people
to come back.
want to be sedated? It seems like that would be another fear, to be sedated.
You know, with today's sedation techniques, I mean, a little pill the night before, a little pill that day, some laughing gas. You know, we have laughing gas in our air conditioning ducts. I mean, that's why everybody's laughing.
Laughing gas in the air conditioning duct.
Only
Kidding about that. Okay, good.
I'm kidding
Now,
about
I looked
that.
it up, and the reason why I thought this was an important show, there are dental, and this is an internet article, dental avoiders, people that avoid the dentist.
Absolutely.
And I guess for some people, when they hear that they could be sedated, it's a big thing.
It is. You know, sedation isn't just for fear, though. There's some people that are very, very busy in life, and when they want to get their dentistry done, they want to get it all done. And to be able to come over to the office, have some sedation, and sit back and get all of their dentistry done in that day and not have to deal with it again.
One of the things
like
with oral sedation is you don't remember what happened, and so 4 or 6 hours of appointment time can go by, and they have no recollection of that time at all.
And they're awake for the most part.
They're awake. We can communicate with
But
the
they can't
patient.
remember. They have no memory
No
of this.
memory of it. But they can get up and go use the restroom if they need to and come back. They're awake, but they're very relaxed.
Randy, here's a great story.
All right.
A guy in Florida that using this exact same sedation technique that Dr. Brad uses had a patient call in the afternoon and say, I am so sorry I missed my dental appointment. I never miss my appointments. I slept right through it. The receptionist said, go look in the mirror. And she came back and said, oh my gosh, I was there.
Is that
So
right?
Yeah.
It's a wonderful sedation thing.
What are the different levels of sedation? I guess there's pills and the gas.
There's a whole range of sedation. We can use just nitrous oxide or laughing gas, and many people are able to do simple procedures, get exams done, or simple things with just the relaxation of laughing gas.
Is that the most commonly
It's
used
in
way? I mean, every
most
dentist does that.
offices. Correct.
Okay.
Yeah.
There's a level of sedation that's called anxiolysis, and that's when we just give one dose of a medication to help with anxiety.
Okay.
As you start to move along the levels of sedation, we do conscious oral sedation. And
That's the one where they don't remember
where they're not going to remember, where they're totally relaxed, but we can still interact.
They're safe. They can get up and go to the bathroom. They come back. You know,
Can everybody do that, by the way?
No,
Every dentist?
You need to have a permit. In the state of Arizona, states are different, but in the state of Arizona, you need to you have board examiners who come and you go through the process of setting up the office, and you need a permit for that.
Do you both have that?
I do the sedation.
You do the sedation in the practice. Okay. How has it changed your practice, by the way? I mean, you've been around for a long time. How has sedation dentistry changed? The type of patients you attract, things like that.
Let me give you the selfish reason first.
Okay.
When you're dealing with somebody who's very, very nervous, really afraid, it really drains you. And when you can help somebody who would otherwise be that way, who's comfortable and relaxed and sedated, it makes it easier for us to get an impression. The day just goes by quicker and easier for us.
Was that something you didn't anticipate? I mean,
Yeah,
you knew you
that
were
was-
going to start doing sedation.
I'm amazed with the response that we have with people who, when they leave, they think they're fine to go, that they can go back to work, and they're just as happy as could be. That was so easy. And I'll say, 4 hours went by. Oh, I can't believe it. And I feel
Is that
great.
right?
And then they end up going home and just relaxing for the rest of the day. But I'm blown away with
Now, I
how-
told you guys on the phone, I said, I don't know about this. This seems like a very boring topic.
Yeah,
But I guess if you're afraid of the dentist, it's not.
yeah.
Because this is a big thing.
You know what, Randy? There's people that are even afraid to come to the office for an examination. Those people can have a level of
Sounds like an
sedation just
exaggeration.
for the examination.
No, there's people are afraid of X-rays, of stuff being forced in their mouth.
What about that process? I mean, could they be lightly sedated for that?
We do a sedation appointment.
Because that seems like the worst thing.
I would encourage people to, if you're afraid of the dentist, come by the office. We don't need to do an exam. Just meet us and talk to us. And if you choose that you would like an exam, we can do sedation for the exam.
And Randy, fear is one of those things you can't explain fear. I mean, you can't explain love. I mean, these are emotions that are far beyond intellectual thought. And so we encourage people, just come by the office. You don't have to have an appointment. Come into the office and meet Stacy. You know, the waiting room is a living room kind of environment. It's not a scary dental office kind. Stacy's sitting right there. And just walk in and say hi to her. And if that's as far as you need to go, leave and come back another day.
Now,
And
one of my
little by
questions here was how much or how little can be done with sedation. You're saying the X-rays.
That's the whole range. We can.
That's the biggest thing for
do
me.
X-rays and
Is I don't like the X-rays.
Check the gums.
A gag.
We can just get a good assessment of what's going on in your mouth. Get the records that we need. We take digital pictures, so we have a big screen we can blow teeth up on, and we can look at pictures. We can look at the X-rays together. One of the things we do is we sit side by side with the patient and help them figure out what their options are. And there's ways where we don't just walk into the room as the doctor and say, this is what you need to have done. Is we can get all those records and really find a way to get things done.
When we were sitting and thinking about how do we explain sedation, we had a patient in the chair. This guy, he's a big man. He got a contract to play for the Yankees right out of college. He came in when he heard from his hygienist in our office that we were planning this. And he said, I think you need to tell people about just nitrous oxide. He said, I gag, I've got sleep apnea.
Yeah.
People who have sleep apnea have a gag reflex that's elevated. He said, without nitrous oxide and that spray that Marianne sprays back there that makes my throat numb, I wouldn't be able to get my teeth cleaned and I wouldn't be able to get x-rays. But with the nitrous oxide and that spray that makes my throat numb, I can do all that stuff.
You're watching the Wellness Hour. I'm Randy Alvarez. We are here with general and cosmetic dentist, the Briggs Family Dentistry, and we're talking about sedation dentistry. And they're explaining that you don't have to be afraid to go to the dentist anymore. We'll be right back.